Right, okay Tina, what we're going to do now, okay, we're going to pop some Botox in the frown lines. First of all, most importantly, you're not going to feel much at all, okay? In the right hands, you really shouldn't feel anything. But just in case, you've got a little button just there in your hand. If you feel any discomfort, just press the button, it'll give a little beep. Just let me know you're feeling something, because it's better than you saying ouch or moving, okay? We often find as well, if you concentrate on something else, like curling your toes up towards your nose, your brain gets a bit confused and often actually won't feel the needle going in at all. Okay, so when I'm about to inject, I'll just ask you to try and bring your toes up to your nose, and hopefully you'll feel nothing at all. Alright? So the first thing I'm going to do, put a little bit in the base of your nose. I want you to gently close your eyes, and I'm just going to pinch the bridge of your nose between finger and thumb. Okay? Now give me a frown so I can feel that bit of muscle. That's excellent. Okay, now relax that completely, and concentrate on bringing your toes up towards your nose. Okay? That's really good. Very good. Do you feel anything? Well done. There's hardly anything at all. Okay, that's great. Now if I could just have a swab, that'd be great. Super. And the important thing as well is, after the initial injections, I don't want you touching the treated area for the next 24 hours, okay? No rubbing, massaging, eyebrow plucking, facials, anything like that. And for an hour after the treatment, I'm going to want you to frown as much as you possibly can. And what that does is it sucks the Botox into the muscle, and it means it lasts longer, it works quicker, and more importantly, less of it is likely to spread elsewhere. Okay? So eyes gently closed, and I'm just going to put my thumb just on your eyebrow. Give me a big frown. That's excellent, and that brings the muscle onto my thumb so I can feel it. Now relax, concentrate on those toes, bring them up towards your nose, and a little bit of a scratch. You might just feel that one slightly. Is that okay?
No, that's fine.
Tell me what you feel at the moment.
Nothing really.
Great. Okay, just relax that muscle. That's super. And I'm going to put one more on this side, so another little scratch coming up just now. That's perfect. Excellent. Super.
I can feel that one slightly.
Very slightly.
I think it's bonier, isn't it?
Yeah, and you just find that with 2 or 3 injections, sometimes the needle just loses a little bit of its edge. You just feel a little bit of a scratch. But marks out of 10 for pain, how is that?
Which way up?
Well, 1 is low, 10 is worst pain imaginable. 1?
On that one and 0 on the other.
Excellent. That's great. And I'm just going to do the same on the other side. Give me a big angry frown and relax. Okay, think about those toes. Curl those toes up towards your nose. That's really good. Excellent. And just one more little injection to go. Little scratch coming up now. That's super. Okay. There's hardly any bleeding there. Chances of bruising are very, very small with such a tiny needle. And you'll probably find the results will start to kick in about 5 to 7 days. Maximum response is probably seen about 2 weeks. Should last you for 3, maybe even 4 months. And you didn't need that button after all.